Today I just want to discuss a little bit about sciatica with you. So a lot of people come to my office saying they have sciatica, they have diagnosis on MRIs of disc herniations and all this other stuff, and they all pretty much come with a lot of the same presentations. And one major problem I see is that when people come in, they have pain on the front of the thigh up here, and they say they have sciatica, and that's definitely not sciatica. It's not anywhere close to the sciatic nerve distribution. It's more probably a femoral nerve entrapment if it's a numbing, or it can be problems with the muscles on the anterior thigh as well. But that just kind of lets me believe that a lot of people don't know what sciatica is. They don't know where the presentation of the nerve goes. So that's why I'm showing you this. So number one, I just want to educate you a little bit about where the sciatic nerve passes through, what are some of the common causes, and what are some treatment options. Okay? So most people come in with, they start off with the, hey, I had low back pain and a hip pain, and now it's starting to go down my leg. All right? So this is the course of the sciatic nerve, like I said. You can have the pain here and here, and all the way down to the thigh here, very common spots. When it gets to the knee, it can go one of two ways. It usually doesn't go both, but it can go one or two. The first way is less common. This is known as the common peroneal nerve. You can't see it very well here, but it goes around to the front of the leg here, or most people know it as the calf. So the front side of the leg, and drops down to the top of the foot. All right. The more common one is the tibial nerve, which drops down this way through the calf muscles, around to the back side of the ankle and to the bottom of the foot. Most people see, or they'll notice, a numbness in the bottom of their foot, either slight or severe, but usually they have some kind of numbness in their foot. So, like I said, many different clinical presentations. Most people have this going on with the low back and the buttocks area, but they can have just all this and down to the thigh, or they can have just all of this up here and just the back of the calf, or again this and down into here, or just this in the foot. You know, there's so many different clinical presentations, but look how long the nerve is. There's so many different entrapment sites. And I'm going to talk to you a little bit about that in a second here. Okay, so let's talk about some of the causes here of sciatica. Most of the ones I see people come in with, and they say that they've been to their doctor, they've been around, and they've had people tell them that the cause of their sciatica is in their back. Okay, in the lumbar area right here, or let me show you on the spine model. Most people say they have one of two things. If they're younger, they'll say they have a disc herniation, and people told them that's the cause of their problem. They might have an MRI showing that they have some degree of a disc herniation. And don't get me wrong, that can be a cause of sciatica, but with a lot of people I've seen, they come in and they have that, and still the disc herniation is not clinically relevant. They have many other problems going on, and I'll talk to you about that in one sec here, but let me just discuss the disc herniation. So the disc herniation, you got to consider all these discs here are more of like jelly donuts in your spine. Okay, when they get squashed, you see this one will have it has a protrusion out of it, and this is the spinal nerve. All of these there's a lot of spinal nerves here that correlate to sciatica, and they make up the sciatic nerve. Okay, if there's involvement of any of these nerve roots by compression of either disc herniation or something else, they cause sciatica symptoms, and there's no doubt in my mind about that. And if you have something like this, and it's definitely the cause of your pain, then you should consider having a discectomy or a microdiscectomy. I prefer the microdiscectomy. With older populations, they have degeneration in the spine, so anyone over 40 upwards, or especially probably to 50 or 60, they get older, and like I showed you, all of these nerve roots come out of the spine through these, they come through these little holes here. These are called the intervertebral foramen. And what degeneration does is it's more or less a increase in bone around a joint. So with these holes right here, they'll get a lot of bony projections going into it, and it'll strangle one of these nerve roots, causing sciatica symptoms. Okay, this is not something that ART can help with. Trying to be completely honest with you with this and the other one. If you really have them, ART cannot help. But and that you might consider it surgery for some of these things, but I prefer that most people come in just to check it out, to see if ART can help them. I'll explain what ART does here with all of these other nerve entrapment sites. So like I said, this is a very long nerve, and when you consider that this isn't the only spot, you start thinking, well, why haven't they addressed all these other spots? I mean, to figure out if these are all the other spots, or any of these other spots can be causing your symptoms. Okay, so this is an extremely common one. It's the external rotator of the hip, called the Piriformis, or the superior inferior glomeruli. The sciatic nerve will actually go through them, and if any of these nerves, if any of these muscles have increased tension, maybe from overuse, sitting a lot, increased activity, they start pinching off on the sciatic nerve, and again, you get the strangulation, strangulation of the nerve, and you'll get the symptoms down the leg. Second spot, the hamstrings. Okay, these two X's right here don't do it justice, because the hamstrings go the whole length of the thigh here. Okay, any spot where it actually, here's a hamstring goes here, one goes here, and the nerve goes right between them. Okay, you can have an entrapment anywhere along there. The next spot is right here. This would be with the common peroneal nerve, or the branch of the sciatic nerve, and it can get trapped right along the gastroc, or the big calf muscles. This is another common entrapment site for the posterior tibial nerve. Okay, it's the there's a tendinous arch of a muscle called the soleus muscle. It's a postural muscle. It's deeper than the big calf muscles that most people want to build up. So that's a very common entrapment site, and so is down here at the tarsal tunnel. Tarsal tunnel is like carpal tunnel of the feet. Same concept here. There's the tunnel itself. You get the decreased space. It compresses the nerve, causing numbness into the feet. So any of these things can cause sciatica. So why not try to get these addressed before you start thinking about having a surgery?